Today we're going to be talking about osteoarthritis and joint health. So for a lot of people, especially as we age, this is a really important topic. And I've got Sarab Dormani, who is a nurse who specializes in lower limb care, who is going to be joining me to discuss this a little bit more in depth and how to properly take care of your lower limbs. So just because we do have two sections of the presentation, we ask that you hold all of your questions until the end. So if anything pops into your mind, we'd love to chat about it. Just hold on to it until the end. Thank you. Okay, so a little about me. So I graduated from the Canadian Memorial Chiropractic College in 2020. I do have experience working with patients who have osteoarthritis. So I implemented a hip and knee osteoarthritis rehabilitation program for 6 months during my internship year at CMCC. The program is largely based on exercise and is rooted in decent evidence. And so we were able to track patient changes and watch them become a lot more active and mobile, which was fantastic. I've also taken the PEAK program for knee osteoarthritis through the University of Melbourne. And I have found good success treating patients with osteoarthritis and implementing exercise programs for self-management. And I've been working as a chiropractor at the Natural Soul Wellness Center since the beginning of 2001. And that's where I met Sarah. So what is osteoarthritis? So if we break down the word, osteo refers to the bone. Arthra is the joint. So it's got to do with the bone and the joint. And then itis is inflammation. So it's a condition that affects the bone surrounding the joint, as well as the joint, the cartilage, and the breakdown of some of these components can cause inflammation, and that's what causes a lot of that pain. This is typically a condition that becomes more prevalent with age, as well as previous serious injury. So if you've had a fracture that went through the joint space, you're much more likely to experience osteoarthritis later, as well as people who decrease their activity as they get older. It can be more prevalent in those populations as well. Another important thing to note about osteoarthritis is that it often involves pain and stiffness in the weight-bearing joints. So if you think about your low back, your hips, your knees, and your feet, those are very, very commonly affected areas. People who work more intensively with their shoulders, elbows, and hands will also experience them there. So some of the words that you may have heard that are associated with osteoarthritis are things like wear and tear, bone on bone, joint degeneration, and joint disease. And I want to address these because these all sound pretty terrifying. So let's break these down and let's take a look at what the actual evidence around osteoarthritis says. So osteoarthritis does involve bone and cartilage changes to the joint, but a lot of the time imaging findings don't indicate how much pain or lack of function a person will have. So I've had patients who have had joints that look really, really badly affected by osteoarthritis on x-ray, but then when they come in and see me, they're like, yeah, you know, I have a little bit of stiffness, but I'm still able to do all of my activities and it's not bothering me too much. And then I've also had the reverse where I've got patients who I sent for x-rays and the x-rays came back showing not too much changes in the joint, but they were experiencing a lot of pain and a lot of difficulty doing their activities. So it's important to note that imaging findings don't correlate well with the amount of pain or function changes that a person experiences. So if you do get imaging done and your medical doctor or another person tells you that they're seeing a lot of changes or they're not seeing a lot of changes, just note that it really depends on how you're feeling and what you find the changes are, because it's more about how it impacts you day to day than what they see on imaging. It's also important to note that moderate and severe imaging diagnosed cases can respond very well to conservative treatment. So simply because you have a lot of findings on x-ray doesn't mean that you necessarily require surgery. And most cases don't require surgery. So again, you kind of want to bring it back to how it's impacting you. Are you having a lot of difficulty doing your day-to-day activities? Are you in a lot of pain? That's probably a time when you do want to go and see a physiotherapist, a chiropractor, some of your other healthcare providers to start working on helping you manage this. And then if you don't respond well to that treatment, then that might be a time that you would want to consider surgery. But the first attempt is always to do more conservative treatment, because if you can manage it that way without having to undergo extreme surgery, that's typically beneficial. So the terms such as wear and tear and bone are harmful and misleading, because that can make it sound like exercise is a bad idea, because you think, oh, if there's wear and tear happening and the joints are bone on bone, then putting movement through those joints and on those bones is going to make it even worse. But what the evidence actually shows is that exercise is one of the top recommended treatments by every recent osteoarthritis treatment guideline. So when people use these terms, it's not really well supported by evidence anymore, and it can be something that leads to a lot of fear. So I tend to move away from these terms, and I tend to tell my patients this isn't really an accurate way to describe what's going on in those joints. And the other really important recommended treatment is education, because again, there can be a lot of fear around what's going on. People might have heard things, they might have seen things on the internet that sound really alarming. And so setting expectations, explaining kind of how osteoarthritis works and what you can expect can really help bring down that fear. And the last point that I do really want to drive home is that you are not your X-ray images. So why are exercise and education so important? So exercise, especially weight-bearing exercise, because again, this typically affects the weight-bearing joints. It can increase strength and mobility, so it can help you continue to do your activities of daily living with more ease. It decreases that inflammation and pain, and that happens through, when you put weight through a joint, it actually helps pump more synovial fluid, which is the nutritious fluid within the joint, into that joint space. And it also increases circulation. So all of these things will bring down the inflammation and bring in better nutrients to try and keep that joint healthy. And that's another reason why it's protective for joint health as well. So even if you're not somebody who experiences severe osteoarthritis, doing some weight-bearing exercise is a really beneficial idea. Now, I do want to put a caveat with this, because if you are somebody who's experiencing symptoms, you want to progress into that exercise slowly. So if you're somebody who hasn't been doing a lot of exercise lately, you don't want to go straight into doing a 20-minute run. You might want to transition into it slowly by starting with a slower walk, doing that for about 5 or 10 minutes at a time, and then building up from there. And the amount of exercise that you'll be able to do and the amount of impact your body is able to withstand will depend on the individual person. The importance around education, I kind of already got into. So education really helps decrease the fear and the stress around osteoarthritis. We also know that fear and stress about musculoskeletal conditions can directly impact pain. So the more stressed, the more fearful you are of a condition that you're dealing with, the more likely you're going to be very aware of it, and the more pain you're going to feel. So talking to the patient about it, explaining kind of what's happening and what they can expect is a really good way to decrease some of those fear and also bring that pain down. So for management, osteoarthritis is well managed with conservative care for mild and moderate cases and some severe cases as well. This often involves a team of healthcare providers who can meet your needs. So if you are somebody who's dealing with osteoarthritis, especially a more severe case, there will typically be a team of people who will be helping you manage different aspects of that. And the treatment should be catered to your symptoms and your goals. So if your goal is to get back to being able to run, if you want to be able to maintain your abilities so that you can play with your grandchildren, whatever it is, the treatment that you're getting should be catered towards helping you meet those goals and reducing your symptoms. So what kinds of healthcare practitioners might be part of your care? Some of the big public health ones that you might encounter would be your medical doctors, your sports medicine doctors, a nurse practitioner, rheumatologist, or pharmacist. So these are all people who would likely help give you prescriptions, education. They might give you orthotics or something like that to help decrease the joint stresses through those joints and help you address the symptoms that way. Physiotherapists, chiropractors, and massage therapists can all help you with the exercise and the manual therapy component. You could also consider seeing a registered dietitian, because there are a lot of foods that you would want to promote to help with joint health. And also there may be things that you want to avoid to decrease that inflammation. And they can also help you address weight. So we do know that if people have increased weight, sometimes that can play a factor in making osteoarthritis more severe. So if weight is a concern of yours, then the registered dietitian would be able to help you address that as well. And then again, if your scenario is more severe and you are having difficulty functioning on a day-to-day basis, then an orthopedic surgeon and a physiatrist would be people that you could talk to about getting surgery and what the treatment after the surgery would look like. And you could rope back in the physiotherapist and the chiropractor and the massage therapist if you were looking to get surgery done, because again, we know that preoperative rehabilitation, and also known as prehab, and postoperative rehabilitation to strengthen the areas that have been impacted by the surgery can really help decrease the amount of time that you have to heal. There are also other professionals that can help. So a nutritionist is also somebody that you can speak to about nutrition to modify your diet and help you with weight loss. You could see an osteopath or a personal trainer as well. So what is conservative care? I've kind of talked about it a little bit. So usually conservative care is a non-invasive treatment and management of a condition. So anything that doesn't involve injections, surgery, anything like that. It's usually the first approach that's considered for any condition because it's the least invasive, it's the least risky. So usually that'll include things like education, strengthening and increased activity, the hands-on treatment, so things like massage, mobilization, adjustment of joints, footwear assessment, and orthotics. Again, that can really help offload some of the stress that happens in those joints and decrease that inflammation. There might be modalities that you can use. So things like a TENS machine, so those little pads that cause your muscles to twitch, things like acupuncture, all of that kind of thing, and then medication. So again, if you find that your joints are very painful and it's making it hard for you to get into the exercise that would be beneficial, then an anti-inflammatory medication might be something that would be beneficial for you. So how can I help? Specifically, my treatment is evidence-based and focused on self-management. Because all of the evidence around osteoarthritis shows that education and exercise is really, really important. That's basically what I like to focus on. Education on osteoarthritis and what it means for you, what you can expect in terms of prognosis. So we know that there is no cure for osteoarthritis, and it is something that does progress with time, but that doesn't mean that your symptoms will change. So managing how you're feeling, getting you into an exercise plan so that we can maintain and even increase your ability to do your regular activities is typically something that I like to talk to my patients about. Then we move into exercise. So again, big emphasis on exercise, but we want to cater it to what you feel you can do and what your goals are. So if your goal isn't to run on a regular basis, then I'm not going to be giving you exercise to get you towards that. I'm going to try and cater it to what you want to do. I also do soft tissue therapy to work on some of the muscles in the surrounding areas. I do mobilization and manipulation of the joints that can really help with stiffness and pain. There are also other modalities that we can discuss depending on what your case is and again, what your goals are. And I do like to focus on collaborating with your other healthcare providers. So if you're working on this with your medical doctor, if you have a massage therapist, those are all people that I would want to coordinate with so we can work on it as a team. Thank you very much. And now I'm going to pass it over to Sarab.
Hi, my name is Sarab Dormani, and I'm a registered nurse specialized in lower limb and foot care, and I'll be talking about osteoarthritis in the foot and ankle. Next slide. So just a little bit about me. I'm a graduate from a Bachelor's of Health Sciences and a Bachelor's of Science in Nursing. And I obtained my license and my right to practice nursing in Ontario in 2012. And I focused most of my career in the emergency department for close to 6 years. And I've specialized in lower limb and foot care in 2018. And since then, I've been able to expand my practice and gain more continuous professional education and orthotic gait analysis, biomechanics, compression stocking, skincare, infection control. And in 2020, I've co-founded Natural Soul Wellness Center, which is our multidisciplinary clinic here in Ottawa, located on Carling Avenue. So why are we talking about the feet? Well, because your feet are essential, and your feet are the foundation of your body. And healthy feet allow us to be active, allow us to be strong, allow us to be mobile and independent. But our feet are also quite of a complex structure, and we'll discuss about that a bit later in the presentation. But what I've noticed in my practice, and what's really, really unfortunate, is that we often take our feet for granted, and we forget about our feet and about foot care. And this mainly happens because our feet are far from our eyes and our hands, and that's why I wanted to focus a bit more about the importance of your feet. So just a few fun foot facts. Each foot has 26 bones. So in total, that's 52 bones. So that means that 25% of our body's bones are found in our feet. And each foot has also 33 joints. So knowing that osteoarthritis causes loss of cartilage in the joints means that there are lots of places where osteoarthritis can occur in the feet. So women are 4 times more likely to develop foot problems compared to men, and this is mainly due to poorly fitted shoes, such as high heels and pointy toes. And 3 out of 4 Canadians will experience foot problems in their life. So foot pains can really vary from injuries, overuse, inflammation, nail disease, circulation problems, leg swelling, nerve endings being affected in the feet. So foot problems can very easily happen. And last fun foot fact is that the average person walks about 160,000 kilometers in their lifetime, and that's about 4 times around the earth. So that tells you how much your feet are really, really important. So we know that osteoarthritis is a condition that causes cartilage loss between one or more joint. And when there is cartilage loss, a lot of painful symptoms can develop, and one of them is inflammation. So what do we know about the causes? Well, we know that osteoarthritis is part of the aging process because the cartilage between the joints wears down due to repeated stress or overuse, and that happens with time. Genetics. Well, genetics seem to be always a factor in the medical world, and unfortunately, no one ever says that they got the good genes passed on. So genetics is another contributing factor. Joint injuries is another cause. So for example, in the ankle, we often see severe fractures or severe sprains or strains, and that can cause osteoarthritis in the ankles very easily. The big toe is another area where we see osteoarthritis, and that's often due to kicking or just jamming the toe or having something just dropped on our toes. Bone deformities such as bunions or hammer toes put the joints in an abnormal position, and because of that, that adds added stress to the joints, and that can easily start progression towards osteoarthritis. And obesity is another cause, as we've talked about. Having excess weight can add extra stress on the joints, particularly on your knees, on your hips, on your feet. And so obesity increases your risk of developing osteoarthritis. So this image is one of my favorite images because it really allows us to visualize how osteoarthritis affects our joints. And we can see in the image how painful osteoarthritis can be. So you can see on the first joint of the foot where the bone toe relates to connects to the foot bone. So you can see how that is being affected. On the top picture, you can see that there is healthy cartilage between the bones, so that every time that joint moves, there's a good slip. But at the image on the bottom, things aren't going so well. So the cartilage is deteriorated, and it's getting thinner, which means that the bones are they're not protected anymore. So they're really hitting each other and they're rubbing against each other, and that can cause a lot of pain and inflammation to the joint. So symptoms, as we mentioned, we can see tenderness, pain when walking, joint stiffness is a very big one. There could be also foot swelling, and that's really specifically at a joint where there would be inflammation and also loss of flexibility because of that joint stiffness. So I'm going to be talking a bit about managing osteoarthritis because we know we can't cure osteoarthritis, but managing the condition is really, really important. And it's important for quality of life. It's important for physical and mental well-being. And it's just very, very important to know how to manage this condition. So I'll be talking about different, sorry, just go back. Thanks. I'll just be talking about a few different non-invasive treatment options, and I just want you to keep in mind that when you're managing a certain condition, that there's often going to be trial and error, just because everyone has a different path of life and everyone responds to treatments very, very differently. So if something works for you, that might not necessarily work for, your partner or your friend. But the key is not to get discouraged and not to give up. So if one option doesn't work, then just be open and trying another option. So keeping active, I know that Dr. Kutney had mentioned about keeping active, and I will too, because you do want to stay active. Moderate exercise allows you to build muscle strength and to relieve stiffness in the joints. So this allows you to build more stability on your feet, and that can also help you to avoid falls. So laying in bed and not being able to move around so much can actually cause you to lose muscle mass, and that might even worsen your condition. Exercise also promotes blood circulation. And we know that our legs are the furthest body part from our heart. So meaning that having good circulation in the legs can be challenging. So keeping active, getting that blood flowing to the legs is very, very important. More blood circulation means more oxygen, more nutrients, and more oxygen and more nutrients means that we're able to reduce the inflammation as well. So you also want to be realistic with your exercises. Mild stretches go a long way. So there are specific stretches for the Achilles tendon and the toes that can help with that joint stiffness. You don't want to start, running a 20K marathon. So don't do any, jumping jacks or anything with big impact because you want to reduce putting any stress on the joints. Yoga is a very, very great mild to moderate exercise, and you can really increase the intensity of yoga as you go along. You want to use light weights again, so because heavier weights do put more stress on the joints. And obviously having a good healthcare team that can help you draw your exercise plans can help you a lot in finding the right exercises for you. So those physical therapy appointments can come very, very handy. So one of the services that I offer and I see very, very beneficial for my patients here at our clinic is footwear assessments. So finding a good pair of shoes can really, really, for arthritic feet is very, very important because not only will it reduce the pain that you already have, but it will also prevent further damage to the joints, to the bones, and also to the soft tissues in your feet. So you have to make sure that your shoes provide you comfort, support, and stability because shoe pressure can cause pain and lead to further complications. Arch support is also very, very important inside of your shoe. Why? Because if your feet are more flat, then there is less stability in the ligaments in your ankles and your feet, which can cause more strains to the joint. And if you have more of a higher arch, then your feet are a lot more rigid and less flexible, and that can cause also the joints to jam. So having a good orthotic or a good insole can really help provide more support and more cushioning to the foot and relieve the stress on the joints. So one other thing that I always measure when finding proper footwear is not just the length of the foot, but also the width of the foot, which I realize that it's often forgotten. So you want to make sure that you have a pair of footwear that has a lot of room for your toes so that you can really wiggle your toes freely and not feeling that they're cramming up or jamming or overlapping on top of each other. So just a quick question, what time of the day do you think that you should be buying shoes? And if you think you know the answer, you can write it in the chat box. So just at the bottom of your screen, you have a little bubble and it says chat. And I'll just give you guys a minute just to type in your answers. Just a couple more seconds. I see the answers are coming in. So most of you have written later in the afternoon, which is true. And the reason why is that our feet and our legs naturally expand throughout the days. So our feet tend to be a little larger by the end of the day rather than in the morning. So shopping for shoes too early in the day before your feet had a chance to expand can actually lead you to purchasing shoes that would be too tight. So if you're gonna throw in shoe shopping in your day, always keep it for late in the afternoon. So you have like the proper foot measurement and size taken for your footwear. So obviously as your foot care nurse, I will definitely advocate about taking care of your feet. And why is that? Because if you have osteoarthritis in the feet, chances are you also have osteoarthritis in your hands, which means that if you have pain in your hands, it can get very difficult for you to take care of your own, to provide your own foot care. So having a foot care specialist in your healthcare team really, really goes a long way. And the reason is that I see that people always get their teeth checked, you know, on a regular basis and their eyes checked. But when we talk about foot care, it's often forgotten. So it's really important to also have your feet checked. One of the things that your foot care specialist can help you do is offer padding and offloading devices to relieve that excess stress on the joints. So there could be padding done to the soles of the foot with either felt or moleskin. Offloading devices can often be little toe spacers. So if you have, you know, a bunion and the big toe is cramming over the joints of the second toe, then little silicone toe spacers can really help just separate the joints and reduce the stress between the joints. Another thing that as a foot specialist I can help with is I can help treat little problems that can be adding more pressure to your feet. So one of the things that we see a lot at our clinic are thick and painful toenails. So toenails that become very, very thick can put a lot of pressure on the joints of the toes. And also thick and painful toenails take a lot more room in the shoes. So it forces your toes to be really, really crammed in the shoes. So when you have your toenails properly trimmed and cut, then you have a lot more space in your shoes. Corns and calluses can also put a lot of pressure onto the soles of the feet or on the top of the joints of the foot too. So having those trimmed and reduced and taken care of can also relieve that excess pressure and inflammation on the joints. So I've listed just a few other alternative therapies that we offer at our clinic that can also help with osteoarthritis. So acupuncture being one of them, chiropractic care offered by Dr. Kutney. We also offer cold laser therapy that helps with inflammation. And the word laser sounds scary, but it's actually a cold laser. So it doesn't cause any burns or it doesn't really heat up, but it just really promotes circulation in the body and helps reduce inflammation. Nutritional counseling is really, really important. We don't often think about nutrition, but there could be a lot of foods that help reduce inflammation, such as, you know, green tea, ginger, turmeric, and there are other foods that can also increase inflammation, such as alcohol or sugars or salts or starchy foods. So if you're not so sure about the foods that you're taking, nutrition, having a nutritionist integrated in your healthcare plan can really, really help. And also if you feel like you need, you have that extra weight that needs to be shed off, often it's just the 5 to 10 pounds that can really, really make a difference and reduce stress on the joints, and having a good nutritional plan can help with that too. We also offer massage therapy, reflexology, and other wellness and self-care treatments. So I've added just one last slide on home remedies, because even though it's great to have a good healthcare team help you manage your osteoarthritis, it's still important to find ways to ease the discomfort at home. Although medication can treat pain, we know that medications have side effects. And I'm not saying not to take medications, but and I think it's important to take medications when it's needed. So if you find that the pain and the inflammation, the stiffness is affecting your daily activities or disturbing your sleep, then you need to make sure that you have something good to help you with these, with managing the pain. When it comes to medication, make sure that whatever that you're taking is prescribed to you. So always talk to your doctor or your nurse practitioner about prescription medication. Do not take a medication that is prescribed but not prescribed to you. So don't start swapping medication between family members or friends. I've seen way too many, damage is done by that, and it's really, really not ideal, because when your physician prescribes you a medication, they also know all the other medications that you take, so they want to make sure that there's no interactions between medications. If you're not sure about side effects of over-the-counter medications, then always talk to your pharmacist. It's very easy to just go walk into the pharmacy and have a consultation with your pharmacist. They're really the best people to help you find probably an over-the-counter medication and make sure that there's no interactions with your prescription medication. Another medication that you can take if you don't want to, ingest the medication, then there's always topical ointments that have anti-inflammatory effects that you can just really rub on your skin and rub on the joints, and it gets easily absorbed and reduces the pain. So when it also comes to pain, hot and cold compresses may be very beneficial because they don't cause any side effects. So we recommend that when you're doing hot and cold therapy, that you would do 10-minute hot and alternate with 10-minute cold, just because the compresses can also help reduce muscle pain and spasm around the joint. So the heat is really, really helps with the joint stiffness, and the cold really helps with the pain and inflammation. You can either do hot and cold towels, or you can do an ice pack or those magic bags that you put in the microwave. But whatever you do, always make sure that you put the hot pack or the cold pack in a pillowcase. You never want to put anything directly in contact with your skin, just to minimize burns. That's it.
Thank you so much for listening, and thank you so much, Sarab, for joining me. She knows way more about the lower limbs than I do, and so it's fantastic to have her helping. So we'd like to open it up for questions. Does anybody have any questions about anything we presented on?
I just had a question about what you said about exercise. If you've already have some pain, and that the exercise helps even to the point of like strength training. I'm just thinking that there must be a point that the pain is, going back to your comment about bone on bone and gives that, image, but is there a point at which pain or inflammation you have to really, step back and let it heal before moving on to the next level or something?
So they're definitely part of the reason why you want to work with like a physiotherapist, a personal trainer, chiropractor, whatever it is because you do want to progress your exercises carefully. So especially if you are somebody who's experiencing some joint pain, stiffness, there's inflammation in that area, you will want to start gradually and then move forward as you go. But the important thing is that you keep your body moving, because as you work movement through those joints, you put some weight on those joints. That's when you get that nutrition and that circulation to that area, which helps decrease that pain. So typically what I like to recommend to my patients, if they notice there's a flare up and they're like, oh, I probably did too much, decrease the amount of exercise that you're doing. So let's say you're walking. So if they're building up and they do 15-minute walk twice a day, for example, and they notice one day, oh, it's pretty painful right now, I must have done a little bit too much yesterday, then I would usually recommend that you do a little bit less. So I wouldn't say stop, because you do want to keep getting that motion into your body, and we know that that's beneficial, but maybe aim to only do 10 minutes that day. Maybe do a different activity, like something like yoga, like Sarab mentioned, that's a little bit easier on the body, but will incorporate more movement. So you want to get creative and kind of change what you're doing if something does aggravate you, but you don't want to stop, because we do know that the movement and the strengthening is really beneficial for people who are experiencing osteoarthritis long term.
How you mentioned the imaging, is always not indicative of people's pain. What's your secondary? Like, do you then go to MRIs? The MRIs are more soft tissue than bone. How do you assess if someone's trying to do an exercise program without progress, and do you go to some sort of secondary imaging to sort of really figure out what's going on, or do you just try to keep with the conservative management for 6 months or a year, or what's the sort of plan for that?
Typically, my approach when I'm working with people with osteoarthritis is I do not recommend imaging right off the bat. If you don't have any concerning signs, so if I don't suspect a fracture or infection or something like that, then imaging doesn't really add anything to our treatment plan. It won't change anything. And because it can cause a lot of fear and stress, because you take a look at those images and you're like, oh my gosh, those joints look so changed. How am I going to make a big difference? I tend not to recommend that patients get imaging done at all. And then typically what I say is, we're going to work on this exercise plan, give this a month, maybe 2. If you're not seeing any benefit, then I would refer you for imaging at that point. And that would be where you'd be looking to progress more towards that non-conservative care. So you would be getting imaging as a prerequisite to getting like an orthopedic consult, or to be getting injections done with your sports medicine doctor, something like that. But it's not something that changes how I would address care as a chiropractor in terms of the conservative care for osteoarthritis.
I think the important thing is always listen to your body and just really, really progress. When I have patients coming in and I'm assessing them for foot pain and they want to get active or mobile, but they're scared, I always break it to blocks of 15 minutes. So we start with whatever you can do in 15 minutes. If you stop it at 10, it's fine. You're still in your first block of 15. And then when you're ready, move to adding a second block of 15 minutes. So a block of 15 minutes doesn't mean it's the full 15. It could be an additional 5, or it could be the additional 15. But the important thing is really, really listen to your body. And like you say, imaging is very objective. It's what we can visualize, but at the end of the day, we really, as practitioners, assess symptoms and what the pain means to you. So I often have patients coming in and they're like, okay, is this like the worst feet you've seen? And I can tell you objectively as a nurse what's the worst thing I've seen, but it doesn't change how you feel about yourself. So it's your symptoms, it's how it's affecting you, it's how it's affecting you being functional throughout the day. And if you're telling me that you're not able to walk like you used to, then we need to work on getting you to be able to walk like you used to, because that's what was important to your quality of life. So that's why with our assessments, everything is really personalized. And I think that's one of the reasons why we didn't add any examples of exercises in this slide, because you need a proper assessment before integrating any exercise. I can tell you, with Achilles tendons exercises or stretches, there are certain stretches where you need to use like a towel to stretch your leg and pull your leg towards you. But if you have osteoarthritis severely in your hands, I'm not going to give you a towel to start stretching your leg towards you. It's going to be very painful. So that's why it's really, really important to have a proper assessment done by a healthcare professional to make sure what you can do and what we can progress towards.
I have a few questions. First of all, what are your thoughts on supplements? I know you talked about natural things like ginger and things like that, but something like glucosamine, I guess, where people I often hear take for joint health. Is that something worth considering? And as well, you just mentioned, Sarab, about hands. I agree that the feet are like our foundation for sure, but I know a lot of us, myself included, experience osteoarthritis like in some of our hand joints where we're cooking, we're computering, and we're doing all that stuff, holding weights even. Like there's a lot of repetitiveness in the use of hands. I'm assuming it's similar into how we have to work with our feet, but is there anything specifically different with the hands and osteoarthritis in that part of our body?
I can just comment. I can just comment on a few things, and you can complete, Chandler. In terms of natural supplements, like taking supplements, I think it's really when you're integrating supplements. If you're not sure, don't play the guessing game. Like have just, even if it's just an hour assessment with a nutritionist that can really guide you through the proper supplements. Just because it's natural doesn't mean that there are no side effects. So anything natural also has side effects. And if you are taking other medications, you want to make sure that there's no interactions, because we often see interactions between supplements and medications such as blood thinner or blood pressure medications as well. So I think a proper assessment is really, really important. If you're not sure about supplements, and then often dietary changes can go a long ways, like, what I've mentioned, and adding, more turmeric to your diet, or drinking that occasional little green tea every night before going to bed instead of a coffee, sort of swapping it around, because we know that coffee is a lot more irritating than teas. And when you're integrating natural supplements, just make sure that you're getting it from a reputable source, that it's FDA approved and Health Canada approved. So there's a lot of people shopping online, trying to find the deals, but that's not always the best thing with supplements. So I think it's important to just get a proper nutritional assessment. In terms of the hands, I don't know if, Chandler, you had any specific exercises or stretches for the hands, because I know that tendonitis is another concern that gets added into the elbow joint and to the wrist joints as well, which can make osteoarthritis a lot more complicated.
So I'll touch on the supplements first, and then we can chat a little bit about the hands. So I do have some backing in nutrition, but definitely not to the same degree as a registered dietitian or anything like that. But from everything that I have studied on osteoarthritis and joint health, the general recommendations based on larger scale systematic reviews shows that glucosamine chondroitin does not provide any benefit. So if you're somebody who takes it and you're like, no, you know what, I do find benefit, then I wouldn't tell you to stop taking it, because you are finding benefit. And so if that's something you want to do, then that's fine. But if you're somebody who's looking to try it, I would just caution you that the larger scale studies have not found any difference between people who take it and people who don't in terms of pain levels and function. So it likely doesn't cause a significant difference. And it's not recommended by any of the major guidelines. So if you look at, there's an organization in Canada, it's called choosingwisely.org, and they make recommendations for orthopedic conditions. And it's actually referenced in our slides. They do not recommend glucosamine chondroitin, and they tell healthcare practitioners that they should not be recommending that for patients because it doesn't show any benefit. So you should focus on things like education, exercise, that kind of thing that do show benefit for joint health. But like Sarab said, there are actual nutritional like nutrients that you can get more of in your diet and address with a registered dietitian or a nutritionist that can be beneficial for arthritis, especially addressing that inflammatory side to bring down the pain. Again, that's not something that I know a lot of, but there are things that would be beneficial for that. So I would definitely talk to somebody more in depth about what kind of things would be beneficial for that. But I just wanted to address the glucosamine based on what I've seen so far. And then in terms of the hands, my approach for what I would do with the hands would probably be very similar to how I would address somebody's osteoarthritis in the legs or the feet. So again, it would be adding in more motion without necessarily adding a bunch of weight. So if you're finding your day-to-day tasks are making it really difficult, so like things like typing, things like washing the dishes and that kind of thing, I would probably suggest doing a light warm-up before you have to do any of those activities, or taking breaks while you're doing them, and doing like a little movement break. So if you find there's a specific spot in your hand that gets really stiff, you want to make sure you're really moving that area. You can do some stretches for that kind of thing and try and get all of those areas moving a little bit more to decrease that stiffness and pain, and then resume that activity that you find that you're having difficulty with. And then long term, that is something that I would probably want to strengthen with my patients as well. So there are like grip strength exercises that you can do and that kind of thing as well that can be beneficial for building up that hand strength and decreasing some of that pain you experience.
I think for warming up, there's the occasional little squeeze ball or the stress ball that can often help. So that's always good to sort of have around the house or in the office. And I think, like Chandler said, taking breaks, sometimes maybe changing a few of the tools that you're using to make it less hard on the joints. So if there's, your pens or your pencils, maybe have sort of like a cushioning padding around it when you're holding your pen or your pencil, or changing the size. If you're washing the dishes and you find that the sponge is like too rough, then there's just little lifestyle swaps that you can do. So, and I think the occasional Epsom salt bath is always something that's good on a day that you're having a flare-up. So just a minimum 20-minute Epsom salt soak, just because Epsom salt is full of magnesium, and magnesium helps relax the muscles. So if you have the muscles that are all stiff around the joints, so sometimes that can also help out.
So yeah, this is our contact information. So there's Sarab's email, and then my email, and the clinic phone number, and where we're located and everything. So if you do have more questions, or you are interested in discussing with one of us about getting some personalized care, please just let us know and we'd be happy to help.